TFEB altered renal cell carcinoma. TFEB rearranged renal carcinoma harbor fusions involving the gene encoding the TFEB transcription factor, typically via 611p21q12. So the translocation is a 611. 611 is a TFEB rearranged. 611. Resulting in a MALAT1 TFEB fusion. When there is a MALAT1 TFEB fusion, TFEB amplified RCC demonstrate amplification of a CP21 locus harboring TFEB, resulting in a TFEB overexpression and its downstream effects. So what happens? It is a 6th chromosome, right? On this there is a TFEB. So what happens is a amplification of the CP21. There is amplification leading to the overexpression of a TFEB. The clinical presentation of TFEB as a renal mass is not specific. Epidemiology: TFEB rearranged RCC are less common than TFE3 rearranged RCC. Only about 100 cases have been reported in the global literature. The mean and the median age is 31 years. 31 years. TFEB amplified RCC occur in older patients. TFEB amplified RCC occur in older patients. See, rearrangement happens in 31 years, while as amplified RCC will occur in older age. Now, how do you remember this actually? The actual way to remember is a TFB rearrangement. Arrangement occurs, arranged marriage, when it will occur at the age of 31 years. And amplification means increasing means in the older age, that is the median age is 65, approximately 50. TFEB amplified RCC have been documented in the literature. Past exposure to the cytotoxic chemotherapy is a risk factor as in any other RCCs. TFEB gene fusion or amplification of RCC results in the overexpression of a native TFEB. Overexpressed native TFEB acts as an aberrant transcription factor that activates the expression of a multiple downstream targets, including those normally activated by the related MIT family transcription factor MITF, such as melanocytic markers and cathepsin K. Recent work showed that TFEB gene expression is increased in a TFEB amplified RCC, although not as much in TFEB rearranged RCC, raising the possibility that other genes at the 6p21 locus such as VEGFA, CCND3 and others may be responsible for the aggressive behavior. Macroscopic do not have a distinct gross appearance as in any other molecularly distinguished RCCs. The most distinctive pattern of a TFEB rearranged RCC is that of biphasic neoplasm. Two phases are there. That means this is a slide means there are two kinds of different patterns you can see in the slide. That is biphasic, comprising of a nest of a larger epithelioid cells and smaller cells clusters around the basement membrane material. So there are at one slide you can see the epithelioid cells, another smaller cells are there but in clusters around the basement membrane. So this is how TFEB looks in the slide. TFEB rearranged RCC characteristically entraps a single native renal tubules at their periphery. TFEB rearranged RCC can overlap morphologically with the TFE3 rearranged RCC when the 3 and B looks similar in morphology. When the population of a smaller cells is small or absent, the differential diagnosis of TFEB rearranged renal cell carcinoma is broader and includes clear cell RCC, oncocytic RCC, and epithelioid angiomyolipoma. The morphology of a TFEB amplified RCC is less distinctive than that of the TFEB rearranged RCC, and it frequently demonstrates high grade. Okay, TFEB amplified is a very high grade, poorly differentiated RCC morphology and frequent oncocytic and papillary features. In contrast to most RCCs, TFEB rearranged RCC underexpress epithelial markers such as cytokeratin and EMA are underexposed, but they do consistently express PAX8. So what happens in TFEB, PAX8 is positive, and other renal tubular markers. TFEB rearranged RCC consistently express the melanoma markers melan A and HMB45 and the cysteine protease cathepsin K. So what are positive in a TFEB rearranged RCC is that PAX-B is positive, melan A is positive, HMB45 is positive, cathepsin K is positive. So these are positive: PAX-B, melan A, HMB45, cathepsin K. Nuclear immunoreactivity of a TFEB protein is highly specific for TFEB rearranged RCC, but a TFEB break apart fish assay is less affected by variable fixation than in immunohistochemistry. So it is the preferred diagnostic test for establishing the diagnosis in the formalin fixed paraffin embedded material. Aberrant melanocytic marker expression and cathepsin K labeling or a TFEB overexpression are less consistently seen in a TFEB amplified RCC, present in about half of the cases. Diagnostic molecular pathology is a 611 translocation is there. Translocation fuses TFEB with the MALAT1. So TFEB, because of the, suppose this is 6 and this is 11, this is 6 and this is 11, there is a fusion. So because of the fusion, there is a TFEB will fuse with the MALAT. TFEB will fuse with the MALAT1 alpha an untranslated gene of an unknown function, resulting in this is MALAT is like an unknown gene, like untranslated gene. It will be sitting aram se, but what happens is TFEB when goes by fusion with the MALAT1 alpha, that will lead to the 611 translocation, that will lead to in turn TFEB RCC. Alternative TFEB fusion partners have also been reported, including the COL21A1, CADM2, EWSR1, CLTC, PPP1R10, ACTB, NEAT1, KHDRBS2. That means TFEB can fuse with the COL, CAD, EW. These are all genes it can fuse with. Precise diagnostic criteria for TFEB amplified RCC remain to be defined. Although the initial study required a high-level amplification and a downstream effects of a TFEB amplification to make this diagnosis, other studies have included low-level TFEB amplified cases. The significance of these cases is currently unclear. Let's see the histology first before going. So here is 611 renal cell carcinoma. Note the biphasic appearance of the neoplasm with a large epithelioid cells at the periphery of the nest and a smaller cell clusters around the hyaline membrane and material in the center. There is hyaline membrane here, material in the center. So what is happening is Around that material you can see the small cells. Then epithelioid cells are here in the periphery. Epithelioid cells, these are. Epithelioid cells in the periphery. Larger epithelioid cells are at the periphery of the nest, and smaller cells are clustered around the hyaline basement. So these are the basement. This is the basement, and small cells are surrounding it. In the periphery, these are epithelioid cells. Staged using guideline for adult RCC only. TFEB rearranged RCC are more indolent than the TFE3 rearranged RCC, with 10% cases resulting in the patient death. So TFEB is less dangerous than the TFE3. We can say that. Of the approximate 60 evaluated cases in the published literature, only 11 have developed metastasis, leading to patient death in 4 cases. Most neoplasm have come to the clinical attention at a low stage PT1, T2, have had a benign follow-up. Necrosis has been found to correlate with aggressive behavior. TFEB rearranged RCC have the potential to metastasize size later. As long as 30 years after diagnosis, TFEB amplified RCC appear to be more aggressive. Amplified is more aggressive, frequently presenting at an advanced local stage or the metastatic disease.